Everybody, thank you so much for being here. A special thanks to Dr. Catherine Toomer. She is the founder of Total Weight Health Institute. I just did a blog recently or podcast, and I was having the hardest time saying that. I keep saying weight loss in my head, and I know the reason for it, for empathy and being caring to patients. So the bottom line is we all know about weight loss, right? But then how do we bring it into our practice? And Dr. Toomer has a really great perspective. It's all about weight and like empathy for people. And that's why I don't hear weight loss at all on her website. It doesn't really talk about that per se. It talks about weight health and really the emotional aspects of it. If you don't know, follow her on TikTok. She has a great, just wonderful with social media, wonderful about communicating. If you guys don't know, we did a podcast this week called Effective Communication, how you can use communication in your business. And she gives 3 great tips that will definitely help you grow in addition to what she's doing today. So thank you for helping out the members of the Female Physician Entrepreneurs Group.
Well, thank you for having me and thank you for asking. This is really great. It's really wonderful.
For those that don't know, Catherine, could you just tell us a little about your history? Like, it's your story that really grabbed me from the beginning. I didn't know you, but I had heard your story, and it really is a way to connect with people. I'm also going to make you, so in case I don't see it, host as well.
Okay.
That's why I'm getting distracted because I'm trying to let people in. So tell us about it. The bottom line is I'm sure somebody here in the audience, and plus this is going to be on replay, they don't know your story. So start there.
All right. Well, to confuse you even more, I actually have now become the founder of Total Weight Care Institute because apparently there's a Weight Health Institute trademarked already. So I had to change the name because of trademarking reasons. So it's Weight Care, which lends itself to the same thing of what I talk about. So my background, I am family medicine, community health. I trained at the University of Florida, finishing in around 1999. So it's been a while. But the reason I mentioned that is through med school, through residency, having 2 children in 3 years, getting married, moving several times, my stress level just kept rising and rising and rising. And just like many women, we learn how to ignore our stress. We learn how to manage it. We learn how to cope. But even when psychologically or even to ourselves, we're managing, our body still responds. And my body responded by really just gaining weight. I got more and I just weighed more and more and more. And eventually what happened, I became a diabetic, ended up on insulin. And then 1 month after my daughter was born, I went into congestive heart failure and was told at the time I had about a 50% chance of living 5 years. My ejection fraction was 15%. I had to choose between holding my child or walking across the room. I couldn't do both. I couldn't stand and brush my teeth. That's how severe it was. And so, but I knew I had to do something. And so I thought, well, I can't take care of my heart, so I'll seek help to lose weight, get my diabetes under control. Endocrinologist kept saying, we're not touching you because of your heart. Just focus on getting your heart better. We're not going to do anything. And then when I sought help from my other physicians for weight loss, mostly what I got was shamed. How did you get this way? How did you let yourself go like this? I mean, you're a doctor, you should know better. And then someone said, you're a doctor, you should know better. That resonated. I did know better. Not so much I knew better not to get that way, but I knew I had the information I needed to reverse it myself. I didn't need other doctors to do it. And so I created my own program. And with the help of my husband, who really had to do all the work for me because I couldn't do it myself, we created what became essentially a high protein, low carb program. But one of the things I noticed was that I had a really, really hard time with motivation. And that's when I realized I was severely depressed. I already had a low level chronic depression, and then I had a cardiac depression and then postpartum depression. And so that's where I started. I treated my depression first. So in creating my own program, I made sure that I went back to my roots of biopsychosocial assessment. And that's what I focused on, my biology, my psychology, and then I focused on my family. I wanted to make sure that nothing I did affected them. When eventually I was able to go back to practice 9 years later, I tried to apply that program to my patients because I knew it worked. I had lost 60 pounds at that point. I was no longer on insulin. I was healthy enough. I survived my congestive heart failure. And so when I tried to apply it to my patients in an FQHC setting, because I was a National Health Service Corps scholar, I couldn't. And so as soon as my obligation was over, I opened my own practice. And it was a micro practice. And that's what I did. And then, of course, I closed because of COVID, went online, grew exponentially because suddenly I could reach so many more people. And I've been doing it ever since. And now I help other people create their own practices.
So it's a wonderful story. And one of everyone here listening, you have to have a story when you talk to people, right? It's all about connecting with people. And so definitely listen to the podcast for this week. If you don't have a story, less likely to resonate. If you just say, I'm going to do weight health, they don't understand the background that you have. And Catherine's story is so strong. I don't mean to make this a competition. There's really no winning your story. But everyone has their own story. Everyone is individualized.
Mm-hmm.
And there's more than enough to go around. So think about your story. Maybe it's something when you were small, perhaps somebody didn't have great health in your family and that resonated with you. Think about the reason why you went into becoming a physician to start off with. So your story, spend time with it. It's so important because you're going to do that on social media and you're going to be doing that when you're doing lives. And this is why you need to watch TikTok for Dr. Catherine Toomer. And you're on other platforms as well.
YouTube is probably where most of my older videos are as well. And my current lives, and also I interview other physicians as well. And so I have what is a quasi podcast called Dr. Toomer Talks. And that's also on YouTube under my live section. But one of the things you mentioned about your story is your own. Nobody else can have it. What I find with most people is they don't care about the details. They just care about how you overcame a struggle. And we've all overcome some type of struggle, and that's all people want to know. How did you do it? How were you going to make them feel? The details don't matter as much. You can help people with weight health. Well, we do it all the time. We treat diabetics, and we're not diabetic. We treat people who are depressed, and we don't have depression. So it's no different. It's just, but resonating, building rapport with patients really, really, really makes a difference, particularly in this situation where many people have internalized the shame and they've been treated very, very badly. Obesity, being overweight, is one of the few areas of society where it's still acceptable to laugh at someone, where it's still acceptable to put them down. It's still acceptable to shame them. And that has been internalized and it's still happening even now.
So going forward into bringing this into your practice, whether you're brand new, like we had come on and Lisa mentioned, I'm still working in the hospital. I want to go and maybe do something on my own or whoever it is. What would you say? Let's start this. Like, how do you start this as far as having the idea, bringing this in? I know that you help physicians do this, but back when you started this, like you had the problem, you were able to solve it. You want to offer it to other people. Walk us through that, what your suggestions would be.
Well, first, I just looked at my end goal and then reversed engineered it. What did I want to have? How did I want it to look? Who did I want to help? How did I want to help them? And one of the beautiful things about doing something on your own is that you can pivot whenever you want. You can change it however you want, whenever you want to. It's yours. And so what I did was decided I wanted to have my overhead low. I wanted not to have a lot of debt. And so I worked shift work in an urgent care center while I financed my small office. It's 1,000 square feet, 2 exam rooms, really small. I could do everything myself. And so I did it that way. Now, that's not to say that's the perfect way, but that's the way I did it. I live in a small enough town where I could do that. And so I started there. So just thinking about the structure, thinking about the financing, and then, of course, having to have an LLC and a business bank account and all the things that you have to have in order for tax purposes, because really we can get around most other things, but the IRS doesn't let us do that. And so setting things up in a way so that I was in tax compliance, and then medical compliance was also there as well. And so so I started there, and as I grew, I did, a few days a week. And then as I grew, I would fill those days and then add a day, fill that day, add a day, fill that day, add a day. And then I realized, I was at a nice pace. I had, a nice number of patients. And then COVID hit. And South Carolina mandated that all medical facilities that were not essential had to close down. Clearly, weight loss is not considered essential, so I had to close down. Um, Fortunately, the most beautiful thing I did and the most important thing I did in hindsight is I had a coach who helped walk me through the transition from brick and mortar to online. One of the biggest things I had to do was suddenly put myself out there. If everyone's looking online, they have to find something. And I had nothing. And I didn't like myself on tape. I didn't like to do videos. I didn't feel like I spoke fluidly enough. All these things. And so the mind drama was incredible. And so, but I did it. And I did it scared, and I did it messy, and it worked. And I just suddenly blew up, particularly on Facebook. But then I went into Instagram, and then I joined TikTok just this year. This has been 6 years. Well, I guess now it's been going on 4 years now because of COVID. And TikTok just really took off this past March. I only joined this past March. And but one of the things I realized, the reason why everything took off so well is because there were so many people out there hurting, and my message resonated with them. Because I rarely talked about weight loss. I just talked about compassion. How, don't be afraid. Don't feel that you're going to be shamed. You're going to be empowered. You're going to feel like you own this. This is yours. And just all of those messages really resonated with people, because that's what I wanted to hear. I became the doctor I needed. And so, and that's what I did. And so I got a coach. I put myself out there and made sure that my message was consistent, and it was consistent across Facebook. Across social media. Now, when I say consistent, what I mean, for me, what that meant was being human. So if you look at my posts, they're not all about medicine. They're not all about weight care. I still put my personal stuff out there every once in a while. I still celebrate my children and stuff, because that's what makes me me. That's my why. And my people need to see my why as well, not just my information, my intellectual property. And so I'm not sure if I covered what you were asking, Sharon.
Absolutely. You did.
Okay.
100%. I'm like, for the surgeons in the background or high cost malpractice, what do you suggest for malpractice getting? Because that's another thing too. Like the hospital employees, they don't have to pay for their own malpractice, but now they're going to go out on their own. Any company that you would recommend, like can you do like per day? I know for surgeries, like per day, we can do something like that. But it's still pretty astronomical. And I just have a hard time with, you're trying to build your practice. It's part of it though, right? Like making money. And I guess that's why you mentioned doing the urgent care in the beginning to help offset things. If someone was strictly doing telemedicine today, any recommendations for that as far as getting out there and using social media?
Well, there's really 4 steps to creating what the 4 steps that I teach in order to create a successful practice. Of course, you have the basic foundational business, the legal things that you have to get set up, and that you can find anywhere. And you can, there's checklists all everywhere. That's what I did. I went online and looked for checklists, and I just checked off what I needed for starting a business. I live in a state where malpractice is relatively low. And so what I did was get part-time family medicine, non-procedural coverage, 1 million, 3 million. And for me, that is roughly about $4,000 to $5,000 a year. That is amazing for malpractice.
It really is.
So
Good for
yeah.
you. I don't.
And then some people get additional omission, errors and omission coverage, which I haven't done, but it's out there. Um, my business insurance, which I got for my brick and mortar, it also covers that. If you can add that onto your policy if you wanted. And so that's another way to go. But primarily, there's really four things that really matter when it comes to building a practice. Number one is getting over your mind drama. Um, there are a lot of messages we get as physicians that tell us we shouldn't make money, first of all, that we're a cog in a wheel, we can't go out independently, we're going to fail if we don't have this huge conglomerate behind us. And so that is the first thing. And a lot of times as we grow, we automatically get nervous, we get a little scared, we have a little self-doubt. Some people call it imposter syndrome. I call it the natural feelings of growth. And usually we grow through them, which for me is bravery. I'm not going to plug my TED talk, but that's really what I don't subscribe to imposter syndrome. For me, it's just, and for anyone really, all of us have done things where we were scared doing it and we did it anyway. And so just getting over that, being able to make money, saying that it's okay, and not also worrying about what we know or what we don't know. We know a lot. The difference isn't whether we know it or not, it's whether we know how to apply it or not. We've learned everything we need to know about how the human body works. We just need to apply it differently, perhaps. And that's it. And sometimes that takes coaching, sometimes it takes a course, sometimes it just takes reading a book. And so because everything we need to know, we've learned already through books. And so that's one. The second thing is just creating systems that work, that are as automated as possible so that most of your time is only spent using your intellectual property. All the busy work is being done by somebody else. And so if you have it where everything is sort of automated up to the point where only your brain is needed and your brain can be used, because that's what ultimately what creates revenue is your intellectual property. So you don't want to waste a lot of your time doing other things other than having to think. And then the third and so that includes patient assessment. You can have things automated so that all the information you need to think and answer questions has already been done before you lay eyes on it. The third is, of course, having the basics of weight loss, the pillars, and just knowing once you've done the assessment, then knowing how to apply them, which is actually quite easy. It's no different than what we've learned in medical school and what we do right now with our patients. We apply, the various pillars, which, you can look up, but medication, movement, behavioral changes, behavioral modification, nutrition, and all the rest that all go into weight health. But ultimately, the reason we do this is because we want to have financial freedom. And there are many different models. There's insurance models, there's cash-based models, there's hybrid models, there's internet models, there's brick and mortar models. But ultimately, all it boils down to is not leaving money on the table. And there's many ways of doing that. And it really just depends on what model you choose as to how you do that. And so those are really the 4 steps to a successful weight health practice.
Ladies, I want to bring this up. Otherwise, it's like a podcast where I'm asking questions. I'm not going to open up a weight health practice. You may be considering this, so this is why you're here. So please ask. Either you can send a message to Catherine, to myself. It's really informal here. You can unmute yourself and ask. You could raise your hand. Any questions? Oh no, it's so quiet. You guys should be asking questions. This is a wonderful time to learn and apply, like Dr. Toomer had said.
Well, there are a few things that, I just ran through things quickly because I did want to give people a chance to ask questions if we had time. But the other is, I can talk a little bit about what it is I see in physicians and what it is that kind of holds us back. And one of them really is our mind drama. Our training, our way of training in the United States, at least, is really based on a shaming system. It's based on hazing, to put it mildly. And so what that does, though, it lends itself to us feeling like we always need to know more. We always need to have more certification. We always need to have more credentialing to prove that we are worthy of treating someone, when in fact, that's not true. Everything we've learned, all the basics we have. And so getting over that often is the biggest hurdle I see in people really creating their own practice, because they feel like they have to have a huge team behind them to do it, and that they need to learn more to do it. They have to have more credentials to do it, when in fact, that's just not true.
Catherine, since I started medical school or left, learning and all of that, I wouldn't feel comfortable at all prescribing Ozempic and those pills. I just want, or shots, right? Because I'm calling them pills. That's how much I don't know. They're injectables. Any advice there on getting caught up for somebody who has not seen this at all? Maybe they're doing urology or some other, maybe cardiology, even something outside of where this would even be discussed with their patients.
Well, there's several places. One of them is the Obesity Medical Association has a lot of courses there. Of course, I have my own course as well, but really it is really understanding, like any medication, how do you decide how it should be used? What are the things you should look for once it's being used? What do you do for each of the situations or scenarios that may come up as a result of its use? And it's really the same like we do for every single procedure, every single medication. And really the most important thing is understanding what's important and what isn't. And so really it's the pre-work, which is the testing, the blood testing, that really now has become so crucial, because these medications have really brought out this militancy with insurance companies and pharmaceutical companies. I've never seen anything like this since the opioid epidemic. I've never seen a medication being regulated as much as this. And so it's really, really difficult if the pre-work isn't done without a diagnosis of type 2 diabetes. But for anyone who does weight loss or any weight health understands that most people who gain weight and can't lose it are on a diabetic or glucose dysregulation continuum. And so that's why these medications work so well, because people are walking around with insulin resistance and don't know it. And so really it's a matter of finding those things. And then each medication has its own protocols, which actually, if you want on where do I have them? I'm trying to remember where I put them, but I did create flowchart.
Do you guys hear her, Dr. Catherine Toomer, or am I the one that's frozen?
Let me see. Okay. Yeah, you're not frozen anymore though. And so really, it's there's a lot of information out there, and basically you look for it in the same way that we're trying to find information on anything else that we want to use. It seems a little more scary than what it actually is, and a lot of it is because of all the sensationalization that has happened around these medications in the last year, when I've been prescribing GLP-1s for over 10 years. I've actually been on a GLP-1 for 8 years, mainly because it does protect congestive heart failure patients. It does protect from diabetes, which I am, because once a diabetic, always a diabetic. And so, there's lots of different ways these medications can be used. And I think the best way to go, if you're really unsure, is to really just seek out people who can help you gather that information and get you comfortable using it. Because really, I don't know any other way that can happen.
Okay. Just for my husband, he's a CRNA, so he talks about how they stop the medication ahead of time. For you guys that don't know, that it causes some gastroparesis. Just be aware of that. But again, if you're listening to Dr. Catherine Toomer, working with her, then you would know this information.
There are two questions here, Sharon, that I
Yeah,
have. I think
me too.
they come to you or to me.
They
you
can
see
be
them also.
both. One is, are you
Okay.
doing weight loss medication? So yes, we've already covered that. Dr. Catherine Toomer is using weight loss medications and she's prescribing them. Can you share how much you charge for your services? And it could be roughly, how often are you seeing patients and do you have dietitians?
Okay.
2 questions
Um,
here.
so do I have, well, I can just go through the question that's here. Do you have ancillary services, nutritionists, trainers, or are you working on patient mindset? So yes, I work on patient mindset mainly because you have to, it's really, really important to, manage expectations, both our own and the patient's. So yes, mindset is extremely important. Plus, like I mentioned, patients have been shamed for so, so long. They attribute one of the reasons why I actually do weight loss and weight health is really not for the weight at all. Weight is simply a symptom of something else going on. And so what I look for is the other reasons. And usually it's something psychological and something biological. It's not behavioral most of the time. Or if it is behavioral, it's behavioral being caused by something psychological or something biological. And so, um, trying to help patients understand that they're not broken, they're not failing, that they are human, and that there are many people in this world who are going through the exact same thing. And like I said, a lot of people say, I suffer from weight loss. I mean, from weight gain. And I say it's not, you're not suffering from weight. You're suffering from societal pressures on you, telling you that you need to be thin. There's a difference. And so, yes, I work a lot on mindset. Um, for trainers, I personally do not do training. I have people who I refer to. I do give people information about what would work best for them. Mainly what I do though is because my program was developed at a time when I could not exercise, it is not exercise heavy. But what I do is get people to the point where their body is at has an environment where training actually is more efficient. And they're more motivated to do it. Trying it early on usually is very discouraging and people just give up the whole process, not just the training. As far as nutrition is concerned, I use an intuitive method. I make sure that people eat enough. That's one of the things I do for monitoring, is making sure that people are eating adequately. That the worst thing you can do as a weight health specialist is create disordered eating or an eating disorder. And so I watch for that very, very closely. And usually there's certain rules that work that's not that difficult. Mainly it's just maximizing water and protein are really the cornerstones of the best nutrition, but then also helping people understand, what what food does in their body and in particular environments. When they're under stress, it does one thing. When they're calm, it does something else. And so really it's just teaching about how our body uses food to make fat and fuel, and then let people try to make their choices and guide them in that regard. As far as ancillary services, yes, I have a body composition, an AI body composition scale that I send to my clients that I can monitor remotely. I worked out a deal with one of the developers for that. And so, I do that. I'm partnered with a few pharmacies, mail order pharmacies, and recently compound pharmacies. It took me a long time to find and trust a compound pharmacist. And the reason I did that is because I saw so many people who were getting such huge benefits from GLP-1s and then suddenly being cut off from them and watching their health deteriorate as a result. And so I felt it was necessary for me to somehow find help for those people. And so I did. Um, And there's another question here about, can I share my flow sheets? I can. What I'll do is I didn't even anticipate needing them today. So I'll give them to Sharon so that she can share them in whichever way she feels is most effective. I think that's the best way to go.
And there's another question here too. Are you
Mhm.
seeing patients outside of your state of practice? So I guess this is more like the coaching errors and
Mhm.
omissions
Yes.
question part.
So I really consider myself more of a consultant than a coach. And the reason is what I do in my coaching is really no different than what I've always done in family medicine. So for me, it feels like it's just part of what medicine should be anyway. So when it comes to consulting within my states of license, yes, I evaluate and I treat. Now, outside of my state of license, I am a national entity with various labs, so I can actually order labs electronically anywhere in the country. Now, what I do with those labs is I use it to create a plan and then a consultation plan, which people can then take to their own physician, and just let them know these are the things you need to hit. These are the ways that you should do it. So it's more of a consultation rather than a treatment. With the pandemic, those laws have kind of been hazy. It's not really clear. It's like they keep changing. I can't keep track. So I just keep doing what I'm doing and let the chips fall where they may. I feel comfortable doing that. I'm 58 years old. I'm near the end of my of my career, so to speak. And so, I figure I have the time, I have the resources to fight whatever comes up. So not everybody would want to do that, but to me, it's a ministry. It's my mission, it's my passion. And so I just help whoever needs help in whichever way I can help them. And so out of state, I figure it out somehow.
Right. And there's now remember, guys, Dr. Toomer does offer consultations. Okay, so I don't want to pull too much information. Could you please speak to the pricing model for labs, consultations, and also clients in the weight loss clinic within your licensed state?
Okay. So what I did, when I started off with insurance. What I found though, because of how I'm trained and because of my mindset, it's really hard for me just to touch on one thing. So I ended up taking over all their patient care and not getting reimbursed for it. I would spend sometime as much as an hour with a patient and get $23 back with insurance. So I just knew that was not sustainable. So I went to cash based, and then I started really streamlining my offer. And so what I did was anything that I could send out that insurance could cover, like labs, like medications, I made sure of that because that would get covered by a patient's insurance. What I also did though was make sure that anything they paid me was documented in an invoice so they could use it, either send it to their insurance company if they did cover it and send it back. As a family physician, I could always code in a way that it was preventative. The other though is that it could be used as a tax deduction for health expense, as a health expense. So I always made sure there was some way that people could get their money back, because I was taking cash. Now, when I first started, I was way undercharging. I'm in a community where we have a high Medicaid population. The cost of living is low, but so are incomes there. And so I didn't want to exclude huge parts of the population. So I kept my overhead low. I kept my prices down. But when I went online, that became, even though my overhead went down, I could spend more and more time, and I really was doing myself a disservice by charging so little. So I did one-on-ones. I created an executive program. It was a high ticket, low volume offer, but the community health part of me was hurting. I just wasn't getting. I needed to feed that part of me, and so I created a group program as well. And so now the group program is primarily where my revenue is generated. I change the prices each year as I increase services, as I increase um, the um, the offer, and then and really have done that for a couple of years. And as I've seen it successfully work, I put it into another program so that other clinicians could use it as well.
Any other questions? Does anybody want to unmute themselves? This has been great. It's been a ton of information. You've been very helpful. How would somebody get a hold of you if they have further questions?
So the best way to get in touch with me really is either through Messenger on Facebook or through my website, which is drtoomer.com, and that's drtoomer.com. And just leave a message, and my assistant will get the information, make sure that I see it, and then we'll set up a meeting to talk. All my consultations are free. I just I'd rather have someone ask me questions, and so that I know if I can help or not. And if I can't help, I do have a large resource, I guess Rolodex from the old days. I'm aging myself. that I refer other people to. If I can't help, I make sure I find someone who can.
So, Dr. Toomer, do you want to go a little, do you want to touch upon what you do offer physicians?
Okay, so I think there's a lot of questions coming in, so I just wanted to make sure that those also get answered. As far as the AI platform, I don't use the actual platform. What I use is a scale called SureFizz Pro, and it is an AI scale. It's a body composition scale, so I can monitor muscle mass. That's usually what I do. I monitor muscle mass much more than I monitor weight. I just want to make sure that as people are coming down, that they are not losing the one engine of their body that helps them the most, and that's their muscle. And so I watch that. But it has other components to it, like diet and other things that can be added, but I just haven't used those as much. It says, can you speak on how to work with other physicians to help them set up their businesses? Would you work with a physician who prefers not to prescribe medications? Absolutely. So what I do is I pretty much give everyone information on how I set up my business, what protocols I use, what testing I use, how I help patients in a biopsychosocial way, what things make, why are my patients successful? When they are successful, what are the components that are common amongst those patients? And so even if it's not medication, there's still several other pillars of weight loss that are required to be maintained, because without now the only reason I say I use medication is because I find something to treat. I don't just give people medicine just because. If I can't find a reason how any medication is going to help, I don't use it. And so what I say is I don't treat weight loss. I treat the reasons for weight gain. And if I can't find a reason for weight gain that is medically treatable, then I use other means. And usually that means counseling, coaching. I do refer a lot to psychologists and psychiatrists because a lot of times it's stress related or psychologically related, which of course, as we know, changes the hormonal environment of our body. So that can be addressed as well. How much do I charge and how often do I see my patients? So with my executive clients, where I started was about $2,000 a month. And so, but what I did with it's a concierge. I would see people weekly. I would, go through every single step of the plan, holding hands, going through, I mean, everything, full access to me, texting, phone calls, whatever. And those were my executive clients. With my group, it's a little different. Definitely, I don't charge that much. But what I do is I meet weekly with my group and we go through all our wins, any questions, anything that people need help with. And then once a month, I meet with each person for 30 minutes. Usually ends up being 15 over time because, once you get to know someone, it doesn't take as long to get through their issues. And usually what those are just simply is to help people not get discouraged. Weight health is a very slow, not a very sexy process. And people see all this stuff online about, oh, I lost, 50 pounds in 2 months, which is unrealistic, it's unhealthy, and it's not what I do. And so often what I do really is just manage people's expectations on what is real healthy weight loss and what's sustainable weight loss. And so that's really what most of my sessions end up being. Did I opt out of Medicare? Yes, I did not. I mean, when I first started, I did not opt out, but now I don't take insurance at all. So it's not even an issue. But I do help people with how to code so that Medicare covers services, because Medicare has as anyone who takes Medicare knows, has a very unique way of maintaining their services. And if you don't do it correctly, there are fines involved. So it's really important to get it right. And there are ways of doing it that are legal, that are ethical, and that also get you paid. And how often are you seeing patients? Like I said, it just depends on my program as to how often I see them.
I have a question here. Time involved to start up a clinic, etc. And is your program demand or live?
Okay. My program is self-paced. My group program for patients is self-paced online, and it's, on, and people follow that. And then my one for physicians, again, is self-paced. It's actually in the process of being launched. I pre-sold it, but it has not been put out yet. Um, there, I'll just put it out there because of some technical difficulties. I'm going to have to put it out differently than what I expected. Some of my recordings lost whole chunks and I had to redo them. So I'm going to put it out more like a podcast, add the slides later so that people can get to it. And so that's how that is. I will have live drop-ins for anyone who has questions, mainly because it is self-paced, it is lifelong access. Some people are buying it now at the lowest price they know they'll ever get it, and they're not even planning on looking at it for a couple of years. Or they're going to hire a nurse practitioner or PA to actually take the course to then add that as a vertical in their office. And so that's what's happening right now.
Catherine, about the time, roughly a time per week to start
Well, honestly, I spend at most 15 hours a week in patient care and work. I do not work, I don't have appointments on Mondays and Fridays. Mondays are my meeting days with my team. Fridays are my self-development days. And so I usually have my own coaching or my own things on Fridays. And then usually I don't schedule anything for more than 5 hours a day, Tuesday, Wednesday, Thursday. And so that gives me time to do anything else I want to do and anything else I want to add. I have that schedule. However, it's never full. If it starts to fill up, I start cutting back because back to back to back to back appointments tends to tire me out. Now, right now, my health has improved considerably. My ejection fraction went from 15% up to 55, down to 25, and now it's back up to 44. So I'm very protective. I measure my revenue by time, my health, and then my dollars. Because I do it that way, I've excelled in all three. And so I have a lot of time. My health has improved. And as of right now, I'm about at 3 times what I made as a full-time family physician. And that's including patient care and verticals. I have some passive verticals that are medically related. I don't consider real estate part of my business, this business anyway. And so that I don't include that income in what I'm talking about.
All right, so you know where to get a hold of Dr. Catherine Toomer. Very impressive, Melville. Thank you, lady. It's really, Catherine, you've been wonderful coming on here, sharing. We always see this, we see a lot of physicians struggling. So it's just getting out of that area and doing something that you truly are passionate about. And the fact that there's people willing to help like you, it's a blessing. Thank you.
Well, I thank you. I have watched you over the years create several platforms that have been very popular, that have been very helpful, that have helped people grow, empowered so many, and it really, really is impressive. And there are several benefits. There are several people benefiting who are just 1 or 2 or 3 degrees separation from you that you probably have no idea how much you've helped them, but you have, and I appreciate that very much.
Thank you very much. I appreciate it. All right, ladies, this will be back on recording. Remember, you can get a hold. I'm just going to put it here. Well, you guys see her. The bottom line is you see her. And this will be on replay.